All right, let's dive into two of the most common cholesterol drugs out there, Simvastatin and Atorvastatin. You've probably heard of them, right? If you or someone you know takes one, you've definitely wondered, what's really the difference? Well, we're going to break it all down.
So that's the million-dollar question, isn't it? Which one is the right fit for you? Now, obviously, your doctor is the only one who can make that final call. But understanding the key differences yourself, that's super important. This will help you ask all the right questions at your next appointment.
But before we get into the head-to-head battle between these two, we need to set the stage. Let's start with the absolute basics. What even are statins, and why do doctors prescribe them in the first place?
At their core, it's actually pretty simple. Statins are a whole class of drugs with one main job, to get the level of cholesterol in your blood down. And that, of course, is a huge piece of the puzzle for managing your heart health long-term. So, who actually gets a prescription? It's not just about one bad test result. The American College of Cardiology points to 4 main groups of people. This could be you if you already have some cholesterol buildup in your arteries, or if your LDL, that's the bad cholesterol, is way up there. It also includes folks with diabetes or other things that kind of stack the deck and increase their risk for buildup down the road.
All right, let's get to the main event. This is what most people are really curious about, the head-to-head matchup. And we're going to start with the big one, side effects.
Just at a glance, you can see some overlap here, right? Both can potentially cause an upset stomach or mess with your blood sugar. But the difference is, they really matter. Atorvastatin is a little more known for digestive stuff like diarrhea. Meanwhile, Simvastatin has this stronger link to muscle pain and feeling wiped out, especially for women.
Let's just zero in on that muscle pain for a second, because this is a biggie. Here's the deal. All statins carry some risk of this, but it's flagged as a much more common thing with Simvastatin. So if you start taking it and you get this new ache, something that feels like you pulled a muscle but you didn't, that is absolutely a sign to call your doctor.
And this is where your personal health history becomes a huge factor. I mean, it's everything. For instance, if you've got kidney issues, Atorvastatin might be the better choice since the dosing is simpler. For both, your doctor is going to keep an eye on your liver. And if you've had a stroke before, a high dose of Atorvastatin comes with a very specific warning. It's all about matching the drug's profile to your body's specific needs.
Okay, now here's a wild card, something that has nothing to do with your health or other meds. Get this, grapefruit. Seriously, there's a chemical in grapefruit that can actually block the way your body breaks down statins, so the drug can build up, which raises the risk of side effects. So yeah, that morning glass of grapefruit juice, it might be off the table.
So, moving beyond the medical stuff, there are the practical details, right? Things like cost and other drug interactions, and they can play a really big role in the final decision.
Let's talk money, because it can be a huge factor. If we're looking at the generic versions, Simvastatin is hands down the cheaper option. But, and this is an interesting twist, if for some reason you need the brand name drug, Atorvastatin, which you'd know as Lipitor, is often the more affordable choice compared to its counterpart, Zocor.
We already hit on the grapefruit thing, but there are other interactions to keep on your radar. For example, Atorvastatin can sometimes interact with birth control pills. And this just hammers home the golden rule. You have to give your doctor a complete list of everything you take. I mean, every medication, every supplement, the whole shebang.
Okay, so you've weighed the side effects, the costs, the interactions. How do you actually make the right choice? Let's put this all together into a simple action plan for your next doctor's visit.
If you only take away one thing from this whole explainer, please let it be this. When you put Simvastatin and Atorvastatin side by side, there is no universal champion. One is not just better than the other for everybody. It just doesn't work that way.
The right choice is always a personalized one. It's a decision your doctor makes by looking at all the unique pieces of your puzzle. Your kidney health, your liver health, what other drugs you're taking, and yeah, the real-world stuff like cost and what your insurance will cover.
So here's your checklist. Be an active player in your own healthcare. Ask your doctor, hey, why this one and not the other one? Check in on how it's actually working. Look at your cholesterol numbers together. Report any new side effects the second you notice them. And this is so crucial. Don't just stop taking your medication. Statins only work if you take them consistently.
And that brings us right here to the final thought. The goal isn't to play doctor yourself, not at all. It's about being an informed partner in your own health. So thinking about everything we've covered, is your prescription a perfect match for you? That's a conversation that's absolutely worth having. Thanks for tuning in.